Good afternoon. My name is Chrissy Matheson, and I'll be your moderator for today's press briefing. Before I begin, I'd like to introduce the Premier of Nova Scotia, Stephen McNeil, as well as Nova Scotia's Chief Medical Officer of Health, Dr. Robert Strang. Go ahead, Premier.
Chrissy, thank you. Good afternoon, everyone. Unfortunately and sadly, Dr. Strang and I have to announce 4 more deaths in our province due to COVID-19. We want to extend our deepest condolences and sympathies to the families and let them know as they are dealing with this issue, we as a province are struggling with their loss as well, and let them know they are not alone. Dr. Strang.
Thank you, Premier. Again, yes, we have to, unfortunately, we have to announce 4 additional deaths due to COVID-19 today. 3 residents at Northwood in Halifax, as well as a resident in Harbourstone Long-Term Care Facility in Sydney, who has also passed away. Like the Premier, I'd like to offer my sympathies and condolences to each of these families as you struggle with this loss. We now have 16 Nova Scotians in total who have died as a result of COVID-19. Today, I'm also announcing 55 new cases of COVID-19, bringing the total number of confirmed cases in Nova Scotia to 827. We currently have 10 individuals in hospital, 4 of those in the ICU. We have 358 people now who are considered to be recovered from their COVID-19 infection, and 23,731 Nova Scotians have been tested and their results have been negative. Again, a testament to our broad testing strategy and our capacity at our labs. We have 10 licensed long-term care homes and unlicensed seniors facilities that have cases of COVID-19, and in total that involves 158 residents and 79 staff. As I said yesterday, Nova Scotia, we have now conducted more COVID-19 tests per capita than any other province. The Kiwi2 lab processed 921 tests yesterday. And while we know that 2/3 of these tests came from within the Nova Scotia Health Authority Central Zone, which is the Halifax and West Hants, about 100 tests also came from each of the 3 other Nova Scotia Health Authority zones. This shows the need for ongoing testing across the province. We still have a lot of people whose symptoms could be COVID-19. We have been aggressive in our testing to identify cases as quickly as possible and then to track those cases and isolate the case and quarantine all of their tight contacts. The testing and the public health follow-up, along with the strict public health measures, has been key to only having limited community spread in most parts of the province, and that needs to continue. We are proud of the testing capacity that we have, and we need anybody in Nova Scotia who develops 2 or more of fever, new or worsening cough, headache, sore throat, or runny nose, to either go, if you're able to, do the online 811 assessment, and if you're unable to do that, calling 811, and then we'll get you, if appropriate, give you further advice on how you can be tested. It's important that we continue to have anybody who might have COVID symptoms come forward promptly and get tested. I know that as the days go on and the weather gets nicer, that the restrictions that we're all under begin to weigh on us more and more. Everyone in public health, whether it's here in Nova Scotia, across Canada, or even internationally, we're thinking about how restrictions can be lifted. And that discussion is very active here with myself and my colleagues in public health here in Nova Scotia. But Nova Scotians do need to understand that this process will necessarily be slow and deliberate, that we need to find the balance between starting to open restrictions, allowing people more freedoms, allowing the economy to begin working again, but also ensuring that we don't do that too much or too quickly, and allowing COVID-19 to get a more aggressive foothold in our province. What we consider normal before COVID-19 is still a long way from returning. Certainly here in Nova Scotia, it'll be several more weeks before we can even begin to start easing any of the restrictions. And when we do, this will be a phased approach. I know that people have lots of questions. I know that you're watching what other jurisdictions are saying and doing, and some jurisdictions in Canada were talking about starting in May, even earlier today in the news. But that each jurisdiction is somewhat different, and we have to base things what's happening here in Nova Scotia, both in our what our epidemiology tells us and what is necessary and appropriate to do here in Nova Scotia. I know lots of people are just anxious to know what life will look like a month from now, 3 months from now. We are working with a plan that certainly will be start to bring that plan to the Premier and his staff for their consideration next week. But it's a plan that we have to all be comfortable with, ultimately the Premier and I. And when we are comfortable with that plan, we will share it with Nova Scotians so we can bring in to all work together to move that plan forward and all be on the same goal. And that goal will remain, our top goal will remain, protecting our most vulnerable citizens from COVID-19, along with protecting our healthcare workers and our healthcare system. It's important also that people understand that even though a lot of the COVID-19, the numbers we present every day and the disease activity we focus on is here in HRM, but there are COVID-19 cases that we're reporting today from other parts of the province. We still have COVID-19 activity and the potential for the spread of COVID-19 across this whole province. Just the fact that we are today, one of the deaths we're announcing, unfortunately, is from Cape Breton, illustrates that fact. We're a small province geographically, and COVID-19 moves as people move. And if we give it a chance, it will move across the province. So for now, we need to maintain our vigilance. It's not just for our own health, but it's for the health of your elderly neighbor, for the health of your sister or brother who is a healthcare worker, for your friend who's a cashier in the grocery store, or for your father or mother who has COPD or congestive heart failure, some other serious chronic condition. Staying home, maintaining social distancing, and following public health directives ultimately is about saving lives. It's about caring for one another by putting someone else's health first. It's about building community that supports all of us to do these things and do them well. And it's about using common sense to make sure that you stick with the strong public health measures rather than looking for loopholes.
Thank you, Dr. Strang. We'll now, Chrissy, take any questions they have.
Just a reminder that each reporter will get one question and one follow-up in the amount of time that we have allocated for today. Also, a reminder to please have your phones on mute. There's a little bit of interference there. First question will go to Canadian Press, Keith Doucette.
Hi, Dr. Strang. I'm wondering in terms of community spread, you kind of addressed it a bit yesterday. Do we have any better handle on exactly where we are with that? And are you still concerned that maybe too many people are traveling around the province when perhaps they shouldn't be?
So we continue to look at our community spread. I look every day with my public health team, and we look at what the latest epidemiology is showing. A lot of the cases, as I've said earlier, that we have the large outbreak at Northwood. We have significant concerns around the spread, the ongoing spread of COVID-19 in HRM, especially in the Dartmouth area. But when I looked at it today, we're seeing actually more spread, and there's more cases in other parts of HRM, in Tantallon and Timberley. So we're no means out of the woods yet, and we do have some other cases occurring in other parts of the province. Fortunately, in many of these cases, because of the early detecting people early on and then isolating them and quarantining their contacts, we're not seeing spread beyond that into the broader community, especially outside of the HRM area. And that urban phenomena is happening globally. When you have larger cities, many people live in multi-unit dwellings, it just becomes harder and harder to control the movement of people and the movement of the virus. That means we have to continue our strong measures. I do have concerns that as the weather gets nicer, that people get a sense of people that, we've been in this for 5 or 6 weeks, they're tired. That's why I keep messaging we're not out of the woods yet, and that we do need to actually work and to stick with the strong public health measures. And again, it's not about so much about ourselves, it's about protecting everybody else in our community, especially those most vulnerable. So we really need Nova Scotians to hang in there, to think about their community, to think about those most vulnerable, and what you need to do to keep everybody else safe.
Keith, do you have a follow-up?
Yeah, in terms of the outbreak in long-term care homes, as the numbers have shown, it seems to have mainly hit the Northwood facility, but now we do have evidence of in other facilities as well. But I'm wondering why there hasn't been a bigger outbreak in some of the other homes. Is something being different from home to home in terms of the response, or is it just a matter of size?
I think some of it's a matter of the size of the facility, but certainly, as I've said earlier, and I've reviewed this in detail with colleagues who are on the ground at Northwood. Northwood just happened to be hit with a number of unfortunate circumstances where they had multiple introductions of the virus, unintended, by staff who were asymptomatic or didn't really realize they were sick. And unfortunately, some of the staff, their job took them widely throughout the facility, as opposed to many healthcare workers work on a single floor or unit. Just an unfortunate set of circumstances. And then because of the 1 to 2 week incubation of this virus, it was allowed to continue to spread, or it continued to spread throughout the facility before the first cases even became identified. So by the time the outbreak was recognized and the control measures were starting to be put in place, the virus had already spread widely through this facility. It's just again, those are unfortunate circumstances. And the flip side of that is that fortunately we haven't had the same circumstance. Our other long-term care facility outbreaks have tended what they generate from a single healthcare worker, again, who may infect 1 or 2 residents, and we've been able to identify that because people became symptomatic very early on.
Next question will go to Heidi with CTV.
Hi. Just a question about Northwood and long-term care homes. New Brunswick hasn't had any deaths in long-term care homes and not as many cases. What's the difference between what they've been doing there and what we're doing here?
So we're all following, there are nationally developed guidance for long-term care facilities that all of the provinces and territories are using. And our approach is very much based on what we do every year for influenza, with some modifications. So that's been used in every other province and across the country, the same general approach. I don't know in specific what New Brunswick is doing, but I certainly know that we're following in general the same approach. So I really don't have an explanation why they may not have had any deaths, but most provinces across the country that have long-term care facility outbreaks are unfortunately having deaths.
Heidi, do you have a follow-up?
I do, and maybe this is for the Premier. Premier, what would you say to those who say that this happening and the very thing Dr. Strang is talking about, where staff work on multiple floors, may have been prevented if the system had just had more staff to begin with and more resources to begin with before this happened?
Well, if you look at the way long-term care is delivered across our province, it's not uncommon, whether it's just other floors or different wings, where people are moving through facilities potentially because of the service they're providing. Whether it's people bringing meals that would move them through different wings, or someone who may be working on one wing on a particular day and works on another a different day. Each one of those are done differently across the province. I'm sure in the aftermath of COVID-19, when we look at this, long-term care will be something that will be assessed. I know the Prime Minister has said he wants to bring it up on a call tomorrow with premiers across the country. But now we're going to continue to work with our partners to ensure that we can try to slow down this virus and then, quite frankly, move it out of our province.
Can I just add that I want to be clear when I mentioned the cases that I know of, it's not because of staffing shortages that individuals were working across the facility. It was actually an entirely appropriate part of their role. One of them was providing pastoral care, and unfortunately, that is their job, to visit people throughout the whole facility. So when I use those examples of how people working across the facility, I want to be clear that it was not because of staff shortages. It was inherent and an entirely appropriate part of those individuals' roles to be moving across the facility.
Next question will go to Mike Gorman with CBC.
Thank you. Dr. Strang, given how pervasive this disease is now at Northwood, and that Northwood and everyone in it is essentially being treated as though they have the illness, how realistic is it that further spread of this and further deaths can be prevented? I mean, what measures can actually be taken to try to reduce the impact of this disease within that facility?
So the main focus is, yes, we're doing what can be done with appropriate infection control, or I'll put it in a different way, infection control that is appropriate for a long-term care facility, which is people's homes, doing those measures as best we can to minimize any further spread, but knowing that the virus has widely spread already, and therefore the main focus is actually what's been done is bringing in additional supports to provide the necessary care for residents, and continuing to test, which has been ongoing, to identify people who are positive and then watch them for the development of any clinical symptoms. I think we have to recognize that even though tragically we've had a number of deaths at Northwood, they have about 140 residents who have tested positive. The vast majority of them have had mild symptoms and remain well, and we've had a number now, and a number more coming in the next few days, who their infection will be resolved, and we're able to then move them to the temporary long-term care facility. So I don't at all mean to diminish the serious nature of COVID-19, but for many people, even the frail elderly in Northwood, they are able to, with appropriate health supports, to battle off this infection and to recover. So a key focus of our work now at Northwood is actually bringing in the additional supports so people can get the level of care necessary to help them recover from this infection, if at all possible.
Mike, do you have a follow-up?
Yeah, thank you. Thanks, Dr. Strang. Today, the majority of new cases you announced actually are not connected to long-term care homes. And I wonder if you could elaborate a little bit on whether or not these new cases are related to the hotspot areas you've previously talked about, Enfield and the Prestons, or if you're seeing spikes in other parts of the province. And regardless, I wonder if you could provide an update on how things are going in those hotspots you've previously identified, please.
So we're not seeing any other spikes. We still have a number of the cases. It's about I don't have the exact numbers in front of me, but about 12 to 15 of the cases are in the Dartmouth east areas, and then we have sporadic cases in a number of other we look at cases by community cluster in a number of other communities in HRM. Some more today that are not on the Dartmouth side, and that's concerning. So we need to follow this very carefully. We are in the process of building increased testing capacity in other communities in Dartmouth to move as fast as we can to identify new cases, and as I said, the critically important work around isolating cases and identifying their contacts. Other parts of the province, we've had a few of our cases for other parts of the province, but they remain isolated, sporadic cases which are not resulting in broader community spread. And that's simply because the public is doing what they need to do to stay apart from each other. And when we do have a case, we work very quickly, and we isolate that case and identify their contacts, test their contacts, and kind of lock the disease down. It is more challenging when you have bigger communities and more people interacting.
Next question will go to Alicia with Global.
Hi, good afternoon. I'm just wondering if you can speak a little bit more about how those with COVID-19 are being treated at Northwood, and just if there is anything that can be done to reduce the risk of those who have already contracted the virus.
So I think careful starts with very good, careful observation, and one of the things that's been done is bringing in some of acute care nurses to supplement the staffing in Northwood, because this higher level of care requires a higher level of nursing and other support staff. For COVID-19, all of the support is supportive. Even people who are extremely ill, we do not have any definitive drug treatments at this point. So it's providing, making sure people are hydrated with fluids by intravenous, if possible, helping them keep eating, watching out for any signs of secondary, infection like a bacterial pneumonia. If they need supplemental oxygen, one of the things that Northwood has the capacity to do is actually to bring in not ventilators but other equipment that can actually supplement and provide additional oxygen to residents. And so it's that higher level of but still supportive care that has been as necessary has been applied in Northwood. But again, many of the residents are actually have mild symptoms and they don't progress to any great extent. And fortunately, they're able to not require much additional care and are recovering.
Alicia, do you have a follow-up?
Yeah, this is just in regards to testing, specifically at Northwood. I know that you guys were testing everybody at the facility, and you were expecting the number of cases there to continue to rise. So I'm just wondering if you can update on the results and what we're seeing with that.
So so a portion of our tests that we have eight new residents today, and a number of staff who are a part of our positives. That's a result of the increased testing at Northwood. I was talking to the director at Northwood yesterday evening. She anticipated by today they'd finish testing the residents. They were almost done yesterday, and then by tomorrow they should have all their regular staff tested. And we were fully aware that as we increased the testing and did this sweep of testing that started on Sunday, we would see more positive results. I'm not surprised by that, but it's actually, we need to know that. We need to know who's positive, and what will be happening now is the residents who are negative, we're looking at how often we repeat their testing, because knowing that many of them, from previous experience in this outbreak, many residents who test positive or negative within a day or two are testing positive. So we need to keep testing those people who are initial test is negative, because to be watching for them to actually be infected.
Next, we'll go to John McPhee with the Chronicle Herald.
Thank you. This is for Dr. Strang. I heard that you met with NSGEU officials today, I assume regarding the concerns that have been expressed by the nurses there about a lack of PPE and other concerns. Can you confirm that you met with them? And if so, do you feel that you addressed their concerns?
No, I had no meeting with NSGEU today.
John, do you have a follow-up?
Yes, I do. This is for Dr. Strang as well. 59% of people with COVID in Nova Scotia are women, compared to 41% men. That's in contrast to the general trend of more men who get the virus. Do you have any idea why this is the case? Perhaps it's the fact that more women work in long-term care?
I think it's two factors that relate to long-term care. We know that predominantly there's a significantly higher proportion of women in long-term care facilities than men. That's simply a factor of our demographics, that women tend to outlive men. And we also predominantly, our workforce in the long-term care facilities is a higher proportion of women than men.
Next question will go to Lindsay Armstrong with All Nova Scotia.
Thank you. For the Premier, the Chief Justice at the Supreme Court said the courts are struggling to provide service in the pandemic because of a lack of investment in technology over the last 8 years. What is your plan to ensure Nova Scotians still have access to justice and avoid backlogs when we get back to normal? And will it include more money for technological upgrades?
Minister Fury and the Department of Justice will continue to deal with the court system and bring forward recommendations on how we address issues that arise within the system, and I'm sure they'll be looking at this.
Lindsay, do you have a follow-up?
Yes. Also for the Premier, the Prime Minister is sending the military to help in Quebec and Ontario, and said today that people have a right to be scared about what's happening in long-term care homes. I understand they're calling in speech pathologists and other people to do work in Northwood outside their typical scope of care. At what point will you ask the federal government for help?
Well, we've continued to ensure that we have the appropriate staffing levels across the province. As you know, in our acute care system, we get rid of all elective surgeries. We were down in capacity about 30%. We then had a COVID unit at the infirmary, which we moved over into Northwood. We continue to provide support from all of our sister organizations. Again, I want to say thank you to a number of the union leaders who have been proactive, been supportive, and their members, quite frankly, who have been very helpful when it comes to deal with this issue. But Dr. Strang, I don't know whether you have anything you want to add.
This question came up yesterday. I mean, certainly we have we call it an incident management team that's on the ground leading this response, and certainly they would be well aware of what the capacity needs are. So as I said yesterday, the need to engage the military is not off the table. We just haven't heard, have had no indication at all that we need to make that request. In fact, what we're hearing is the exact opposite, that the necessary supports from the other parts of the health system, as the Premier's outlined, are in place now, and we have appropriate capacity now at Northwood.
Next, we'll go to Paul with Radio Canada.
Yes, well, most of my questions have been asked already, but I do have one remaining question for the Premier. A few weeks ago, you were extremely frustrated about people not maintaining social distancing. Are you less frustrated now? Do you believe that people are staying the blazes home?
I think people have begun to understand the severity of this virus. People are across the province are finding unique ways to self-isolate with their families. We see communities holding each other to account when we go across the province. We're coming into another weekend, obviously. I'd be kidding you if I told you I'm not worried about the fact that that the public gatherings and the more communal gatherings happen a lot on the weekends around our province. We know there are some pockets where there's still activity happening, but I think by now people have seen many examples of how quickly this virus can spread. We now know you may be asymptomatic and still be able to spread it. We know there are lots of, particularly people who have minor symptoms who are out working in the community who could be spreading it. That's why more than ever we need to continue to follow the public health protocols. We both, Dr. Strang and I both, want to be in a position where we're starting to lift some of these restrictions in our province, but that's only going to happen, and it can only happen if we all start following the public health, keep following the public health protocols, and we see the positive trends and signs. So while I'm grateful for those Nova Scotians that have continued to follow that, we all need to be vigilant to make sure we continue to follow the public health protocols.
Paul, you have a follow-up?
No, thank you.
Next, we'll go to Greg Mercer with the Globe and Mail.
This question would be for the Premier, and it's actually about the shootings on the weekend. Many Nova Scotians want to know why the emergency alert system wasn't used in the weekend rampage. They believe lives could have been saved if it was. I'd like to know if the Premier shares their concerns, and does he accept the RCMP's explanation for why that system was not used?
I watched the press conference yesterday. As you know, that system is available. It needs to be initiated by the lead agency. They're in the process of going through their investigation, and I'm going to allow that process to happen. I do want to recognize and thank the men and women at EMO for the work that they were doing and did on the weekend. And the proactive approach, but the lead agency or the RCMP then will determine and tell Nova Scotians after the investigation on the protocols. But I think there's a lot of people hurting in this province. There's no question, and I get the understanding and I get the desire why people want information readily available today. These are complicated sites, but I think we need to allow this process to happen. In due time, everyone will know exactly why it wasn't used, but I think we need to let this investigation happen.
Greg, do you have a follow-up?
I do. The RCMP have launched a tip line for information. Is there anything the Premier can say to people who might have information about what happened in these killings?
Like I would on any crime, if you have any indication, any bit of information, call it. Let the law enforcement agency determine whether how valuable it is or not. We have family suffering. We have communities suffering. Our province is suffering, quite frankly, through the violent tragedy that hit our province last weekend. And if there's a single Nova Scotian or anyone who thinks they may have some bit of information that may be valuable, please call that tip line and let the law enforcement agency determine whether or not it has value.
Next question will go to Sarah White with the Aurora newspaper.
Good afternoon, Dr. Strang. In the course of preparing for COVID-19 response, military medical personnel at bases around the province have withdrawn personnel who also work in regional health authority facilities. Can you talk about any impact that's had on operations and procedures over the past few weeks, or has it been accounted for in overall rescheduling?
So that's a level of detail that's better ask that question to the Nova Scotia Health Authority. I've not been made aware that the withdrawal of military personnel from our community hospitals has had any substantive impact.
Sarah, do you have a follow-up?
Sure. Mr. Premier, you mentioned partnerships with other health organizations and the unions. Does it reassure you to know that the military bases in your province and region are standing up their local response forces, 14 wings set up last week? They have your back. They're ready.
So very early on, I reached out to Atlantic Command to get an assessment what would happen. Listen, I'm grateful for all three branches of the Canadian Armed Forces that are in our province who continue to, first of all, continue to help build communities from one end to the other. But quite frankly, whenever our province is facing challenges, we know that we have a friend in the Canadian military who come to our rescue. They did it during the most recent storm we had from all across the region, and I know they will here if required. We as a province are very fortunate when you look across the Federation for the number of men and women in the Canadian Armed Forces who call this place their home for work, and when they retire, they come back here to live and help continue to build our communities. Yes, I'm very grateful and reassured that we have the level of support we do from the Canadian Armed Forces.
Next question will go to Bill Martin with 6 Rivers News.
Thank you. With all the deaths to date in Nova Scotia coming in our senior population, there's a sense growing very clearly among younger people that they don't have to worry. Dr. Strang, there's nothing we can say about the numbers in Nova Scotia to date, but could you offer some statistics by age group, perhaps even in a separate press release, that would underscore the danger is very real for everyone?
So I don't have any statistics in front of me, but we certainly know that if you look at this from the overall, from an international perspective, that while people who are over 65, people with chronic illness have a higher risk of severe disease, it's only very young people, children, that really appear to have really no or minimal risk of severe disease. Even teenagers, young adults, there certainly are cases that there is some level of risk of severe disease, even dying in younger adults, previously healthy young adults. Those are certainly happening. So this is a disease that can touch pretty well everybody, no matter what the age. But also I emphasize the fact that I keep coming back to that if that doesn't concern you, then you should be concerned about what impact you may have on other people in your community who may be at at much greater risk of severe disease and dying if you transmit COVID-19 to them. So while it's about individuals and their level of risk, and everybody is at some level of risk, and that should concern them, even more importantly, it's that what level of risk are they taking by not considering those in their community around them.
Bill, do you have a follow-up?
Yes, thank you. For the Premier, Dr. Strang has been steadfast in releasing numbers of infections only by the 4 healthcare regions thus far. But last Friday, and again on this past Monday, the MLA for Cumberland North issued a press statement saying that she had good news, that Cumberland County had not a single case in the county. Is this a reporting change of policy, or do the elected officials get more detailed information?
No, they would have been, I can tell you exactly what happens. Usually in the morning, there's a conversation between the caucus offices that if there's questions that local members may have or issues that are arising, we try to provide them answers. If there are issues associated with our policies, we provide it with them. But all of that information that we would share with them, it gets communicated here every day. Dr. Strang laid out in our modeling potentially is where that number is coming from. You would have seen our modeling had it broken down a bit more than others, but I'm not sure where the MLA would be getting her data from. What I can tell you is this virus is changing every day, moving every day. Today we just announced 55 positive ones. They weren't all here in Central Zone. I would strongly encourage any MLA not to give false hope to people in any part of our province. The reality of it is this virus gets transmitted quickly and quite honestly has devastating effects for families, as we've found out again today.
That's all the time that we have today for questions.
Thank you, Tina. Today is a tough day for many families in Nova Scotia, not just for those reeling from the tragic events of last weekend, but now we have 4 more families in our province mourning the loss of a loved one from COVID-19. All of this death is taking its toll. Nova Scotians are hurting. Dr. Strang and I are hurting. We all need to find our own way to grieve and mourn the loss of all those who've been taken from us. And it's hard right now because we have to support each other from a distance. Pick up a phone, FaceTime a friend, offer a virtual hug. But for those who need a little more support to cope, there are resources available to help. Kids Help Phone is now providing phone and text support not only for kids, but also for adults who need to talk during this tough time. Text NS Strong to 741-741. The Mental Health Provincial Crisis Line is also available 24/7, and the toll-free number is 1-888-429-8167. Everyone deals with the tragedy in their own way, and no one way is the right way. So do what you have to do. But whatever you do, you don't have to do it alone. Remember, you have support, you are loved, and we will get through this together. We are stronger together.